Well, it looks like we're about ready to start.
Perfect.
So I'd like to welcome everybody. My name is Julie Kofed. I'm Vice President of Marketing at KORR Medical Technologies, and KORR is delighted to present Dr. Cameron Garber today. Welcome, Cameron.
Thank you.
Cameron is going to talk to us about exercise, physiology, and wellness, and do an analysis of the implementation of a metabolic VO2 testing-based program to promote health and wellness. We are so happy that Cameron has been a friend of KORR and has been an advocate of this technology for a number of years. So let me tell you a little bit about Cameron. Next slide. So Cameron Garber is a doctor of physical therapy and owner of Body Smart Utah. Like many health practitioners, his objectives revolve around helping people achieve their goals. His goal is not just to help individuals one-on-one through his practice, but also to create programs and companies which will help improve the health and wellness of my community as well as the whole. So welcome, Cameron, and let's get started.
All right, thank you so much. Appreciate that, Julie, and appreciate your support. This is a fun thing to be able to do. Welcome everybody in that's on. It looks like we've got a good group growing. So thanks so much for being here with us. So a little background on my story. So I was a practicing neurological physical therapist working in a neuro setting where I helped brain injury, spinal cord injury, and mainly stroke. I was kind of our stroke team lead there at the University of Utah. And really kind of an interesting experience. I was tasked with building our wellness program there, helping to grow that as our practice expanded. And as part of that, I realized that we were on the wrong end of wellness. You know, working with stroke wellness, we could have prevented so many of these strokes had we done kind of the right steps. And if we kind of fast forward to what I had done in my previous kind of experiences and career, I had worked with an excellent physical therapist named Julie Knighton, who did metabolic testing, so VO2 Max and RMR testing with her patients to help them lose weight and get in shape and all those things. And it was such a great help to me. And so having that skill, knowing how to do that, and then seeing kind of that we're on the wrong end of wellness with this stroke wellness program, although it was great, it just was kind of not quite what I was hoping to do in terms of helping people avoid those things in the first place. And so that's when I decided to kind of make that leap, buy the equipment from KORR, and start on my own. And well, we'll kind of get into that a little bit more, but it was pretty awesome to see how just doing that one day a week, I just was doing that on my days off, I was able to generate enough business and enough interest that I was able to pay off the equipment and start building my practice, and now it's grown into quite a bit more. And so excited to be here with you, and that's kind of my journey as to how I started the metabolic testing and started really building this up with my patients. So moving forward, let's kind of take a look. So what we're going to cover today, got a few main objectives. So first off, we're going to talk more about prevention and why physical therapists are involved in prevention and why physical therapists should be doing weight loss and getting involved in this stuff. What is the advantage and structure of a metabolic-based PT program? And then the side goal is myth busting with some metabolism myths. So anyway, so as we get started, it looks like somebody was saying that our volume needs to be turned up. Can everybody hear me okay? Just drop a comment in the chat if you can't hear me. If you need me to turn up my mic, I can definitely do that. Everybody hearing me okay? All right, so sounds like, it looks like I've got pretty good audio. So if you can't hear me, let me know. So prevention, I'm a big believer in doing more preventative things. Like I said, I really didn't want to work on the back end of stroke rehab. I wanted to get out in front of it. And the problem is prevention is such a hard subject to broach. It's something that's difficult to really engage with patients, to tell them that they're overweight or unhealthy and things like that. And so it's hard because we don't feel like we have many options as a clinician to do more preventative things. We feel like we don't quite have the time. We don't really know what's a good option for me to be able to work with people that's a science-based, results-based, and not just another next fitness fad or gimmick coming along. And so we don't really have answers or options for people. And so we just feel mean if we bring up the fact that people need to lose weight. And so by having this metabolic testing as an option, it gives me the ability to address weight and address fitness in a whole new way that makes it me not come from the standpoint of kind of being mean or picking on them, but really from a standpoint of I've got some answers for you that really will help you change your lifestyle and not just be another quick fix diet. So that's what I love about having this as an option with the metabolic testing. So here we go. Why should physical therapists then get involved with weight loss and fitness and health? Well, so really weight loss, fitness, health, it's all about eating less and moving more, right? Physical therapists are experts in the moving more part of things. We are really, here in the United States, we're the only licensed health professional that is trained in exercise prescription, PTs and OTs. We have a background in evidence-based medicine. We understand different people from different walks of life, as well as different comorbidities, different things for that medically complex patient. And so one of the bigger things too along that route is with those people that are medically complex, they often have several reasons why they have stopped working out, you know, injuries or other things like that, that a physical therapist is really targeted towards helping to remove those roadblocks. And then physical therapy as a profession, we just kind of are structured to be able to give our patients a little bit more time than many other clinicians. And so it really puts us in a great position to be able to help in that way. So what is the advantage of a PT based? We kind of touched on a few of those, but we can give people a comprehensive program that we can really take a look from the perspective of that licensed healthcare professional, some of these accurate measurements, some of these things that give us more true information than most of our fad diet programs. And so this metabolic based program really gives us the opportunity to give people true information about their body, about their calories, about what they should do for their exercise, for their body. And it's based on sound clinical information, tons of research on this, and it's designed around accountability and follow-up, and it gives us something measurable with fitness that we can actually measure and show people that they're improving in a much more specific way than a lot of things. So it gives us that ability to have testable results and not just another fitness fad. All right, so one of the things that I like to talk about with this, then those are the things we're going to cover. This is some of the myths we're going to bust. A lot of the questions that I get from my patients are things like, do I even have a metabolism anymore? And then everybody wants to know fast versus slow. What makes my metabolism slow down? Do I need a fast metabolism? Do I want a fast metabolism? What are the things that makes it fast and slow? And so we'll talk about some of those things and hopefully answer those questions. Really, in my opinion, it doesn't matter how fast or slow necessarily. It's more that we understand what to do with your metabolism and we treat that appropriately, that we make the adjustments for your body that we need to. And then we can worry about fast or slow down the road as we make some changes to help you lead a healthier lifestyle. So what does my program look like in helping people answer those questions and lead this fit and healthy lifestyle? Well, first we start off with screening and that comprehensive health risk assessment so that we make sure that everybody that's participating is healthy enough to participate. Next, we're going to do the resting metabolic test, so the RMR, and then that leads into our exercise test, VO2 or VO2 Max Testing. We'll talk more about what a true VO2 Max test is and kind of more of what I do. And then exercise prescription and follow-up is kind of that last phase. And these are all important key elements in building a metabolic program and how I work in my practice. So here we go. This first step of the game, what we're doing here, we do the pre-screen of making sure people are fit and healthy enough. So I use the PAR-Q and the ACSM pre-screening just to make sure that people don't have any major red flag items before they participate, so that we can address those and make sure people are safe enough. You know, I always kind of half joke with people that I'm trained in CPR, but I would hate for them to be my first failure. Oh, I got a note that the video has stopped. Is everybody else doing okay? So yeah, it looks like things are good on my end. So let me know if that's still the case. Anyway, so we've got those screening. We just want to make sure that everybody's healthy enough to participate and that there aren't any major red flag items we need to have checked out first. All right, then we go through a whole bunch of measurements. And the key is taking a lot of different measurements rather than just relying on one. You know, things like the BMI gets a bad rap because as a standalone measure, it's not always the best way of looking at things. It's not always accurate for the individual because we have people with different body types, different ethnicities, other things. And so being able to look at waist to hip ratio, waist to height ratio, body fat percentage, blood pressure and other things, we can kind of get a bigger picture of where someone's health is and where they are at in terms of essentially those key things that will adjust their risk factors to their health. And so that's one of the things I look at really closely is those health risk factors to make sure that we're not doing anything that's going to compromise their health. All right, so after those baseline measures, that kind of sets the basis for our follow-ups and everything. We move on to the metabolic testing, and this is where the fun begins. So metabolic testing, the RMR test, is kind of like what it shows there. People just relax comfortably and kind of get to take a nap. With the meta breather in their mouth, they are able to capture all of the expired air so that we can measure that. So this gives us some good information about their baseline energy requirements, essentially how many calories do they use in a day if they were to just sit there in the chair. And this really gives us some good information that we can base the rest of our program on for them so that we make sure that they're eating enough, that they're not underfueling their body, and that we can really custom tailor the program to them. All right, so with this, we want to make sure that they understand the information that we're giving them, and we can use that to help them get motivation and better understand what their body needs. So we do this kind of a calorie balance program based on this baseline measure we get from the RMR. And so, you know, most people base their program on kind of a calories in, calories out. Obviously, if we burn more calories, then we're supposed to lose weight. I found that it's not quite that easy, and we'll actually run through some of the math as to why a calories in, a traditional calories in, calories out program doesn't always work for a lot of people. So portion control is a big key, a big goal, as well as setting goals that are based on them and their body. And then on the nutritional side of things, I'm a little bit controversial there in that I don't give as much specific nutritional information as a lot of people do. I kind of believe that we've got to be careful with our territories there. I work really closely with a few dietitians, but I do give some general food recommendations based on the CDC and USDA information, even though some of that's not always the best. But I kind of just refer people to several different resources, and I talk a lot about just eating real foods versus food products. That's kind of one of my main messages, is trying to get people to eat real food. So we'll talk a little bit more about that later, but I kind of err on the side of not stepping on dietitians' toes. So let's talk a little bit more about what the RER is and what it can tell us. So if we see here, we've got this respiratory exchange ratio graph. So during one of the tests, this is what pulls up. And the closer this orange line is to 0.7, the more we're burning fat as fuel. The closer that gets to 1.0, the more we're burning carbohydrate as fuel. And so that's a really interesting thing in being able to help people know where they're at with that. With those calculations, we can help people understand what type of fuel they're burning and how. So let's look a little bit about that with the RER. Here is kind of the math. This is several years worth of school kind of balled up into some simple equations, but essentially this is how it breaks down into the 1.0 and the 0.7. If you want to dive more into that, we definitely can, but it's a little complex for what we're going after today. But essentially this is how it works to calculate out how many calories and what type of calories. Essentially, it's using the amount of oxygen to tell us, and carbon dioxide to tell us how many calories are being burned and what type of calories. And we know that about 1 liter of oxygen is equal to, per kilogram of body weight per minute, is equal to about 5 calories. And so that's how it's all based. It looks like people are having some video options. I don't know. There are some video problems. I don't know if that is global or if that's just a few people. So if those continue to be a problem, let us know. All right, so here we go. This is one of the printouts that people get to help us understand their RER and their energy balance and that resting energy expenditure. So this is kind of what we use as a tool once we have done the test to help explain that to people. And so let's zoom in a little bit more closely so we can see the main information that we get. We'll dive back into this quite extensively, but this gives us that calorie balance. Honestly, I never really use that medically supervised zone. I don't feel like that's very appropriate. In fact, I don't even use the lower end of the weight loss zone. Typically, I prefer not to lose weight through restricting calories. What I found is a lot of the time when we do that, our body just adapts and finds out how to live off of that lower calorie amount. And then when people are done with their diet, they wind up going back to eating the way they were before after having slowed their metabolism down. So I usually try to shoot for at least that resting energy expenditure as their calorie intake, if not a little bit more depending on their exercise habits. But this gives us some really good information by measuring the air that people breathe out, because that's essentially where our calories go. When we burn calories, they turn into air and a little bit of water as well, but they turn into air. And so that air that we breathe out, we measure that, it gives us this information, and we can understand exactly how they're using those calories. So let's dive into a little bit of why the calories in, calories out diets don't work, and why cutting calories in your diet below what your resting energy expenditure is kind of backfires on you. So it's all based on this idea that 3,500 calories is equal to 1 pound of fat. So the prevailing idea is, if we use some of our online calculators or apps, is that if we create this negative 500 calories per day calorie deficit times 7 days a week, that's going to equal this negative 3,500 calories, so that 1 pound per week. Well, close, but not quite. 3,500 calories does not equal 1 pound of fat. 3,500 fat calories is equal to 1 pound of fat. And so really we're looking to create a negative 500 calorie per day fat calorie deficit. So we really have to look at, we're trying to get rid of stored fat on our body if we're talking weight loss. And so getting rid of stored fat on our body isn't just creating a negative calorie deficit of the calories coming in. We've got to burn off stored fat. And so we want to make sure that we're tipping that calorie balance in the direction of weight loss by getting rid of fat. And so looking at that equation up there, that's how every online calculator or app is built. Well, so let's look at the truth behind the matter. With exercise, so this is based on the same patient. With exercise, kind of at a moderate intensity, they're going to burn somewhere between 200 to 460 calories when we did the actual test with this person. And so 200 to 460 calories in a half hour to an hour's worth of time. And then lifestyle and activity is very variable. Just depends on that day. So if they have more of an active day, they might burn a little bit more. A more sedentary, they may even burn less if they were sick or something like that. So 300 to 700 calories there. So looking at this with the traditional 500 calorie deficit equals 1 pound of weight loss per week, we look at that and we go, yes, this is awesome. 500 to 1,200 calories per day deficit if I just kind of do the bare minimum, move a little bit and exercise just a little bit. I should lose between 1 and 2.5 pounds a week. Sweet, yeah, this is great, right? Well, here's the problem. Really, in this equation, we're missing out on a few things. So when we take a look at it more closely, that 200 to 460 calories, we're really, if we're going slow enough, if we're burning in the zone, and we'll talk more about that we want people to exercise in, they're really only burning about 50%, sometimes a little bit more or a little bit less, but somewhere around 50% fat if they're exercising slow enough. Now we're talking on their exercise or their lifestyle and activity calories, depending on what they're doing and how long they do each activity, somewhere between 40 to 60% fat, maybe a little more, sometimes a little bit less, depending on what they're doing. But again, we're talking about half of those calories as it averages out through the day. So really, when we add that all up, instead of that, 1 to 2.5 pounds per week, we're really talking about maybe a half pound to a pound per week if we're kind of on this higher end of things, right? Because we have to factor into the fact that it's 7 days a week, and most people don't necessarily exercise every single day. And so that calorie amount, we really have to cut those things in half instead. So our total winds up being much, much less. And so our weight loss is much less. So things are a little bit slower that way than what most calories in, calories out diets would suggest. And so what that leads to then, because that's a lot less, it leads to people getting frustrated and bailing on their diet, right? They get so frustrated because they're not seeing the results. They go 6-8 weeks and they haven't lost the weight like they thought they would. And they're going, what the heck? Why isn't this working? I'm putting in all this effort. I'm eating a lot less than I normally do. All these things. Why am I not losing the weight? Well, the math may not be in their favor, and because they didn't know the math, they weren't empowered by that information and able to make the right decisions for their health. Is how much to exercise, what intensities to exercise, how much to eat, and eating in a way that doesn't slow their metabolism down further and make it so that the numbers are even less in their favor. So that's a big key, is helping people figure out this calorie balance. So that's a lot of what we do on the coaching side of things. I've got a blog with a lot of tips and tricks for people. We help people set goals that will help them maintain their progress, maintain their health and fitness, and help them to avoid some of this mindless eating. One of the things I talk with people a lot is managing their decisions versus their reactions to food, making sure that their decisions that they make are based on their wants and needs and calorie budget, and not based on just reacting to food. So we talk a lot about avoiding hunger and some other things that really help empower them to be able to take control and make concrete decisions about what they want to do in their life. Instead of just reacting, we tend to react quite a bit. And one of the biggest areas that I feel like I can help people to be better at making those decisions versus reactions is in awareness and planning. If they can really be aware of where they're at and what decisions they need to make, and then plan those decisions out or plan for success in making those decisions, people are a lot more successful. So the other thing is I refer out a fair amount to other people. So we really have to be careful with our scope of practice, kind of like what we talked about, referring out to dietitians. And I'm a bigger fan of referring out to dietitians. Nutritionists, you really have to vet each nutritionist and make sure that they're qualified. Because there's a few things with nutritionists that are just kind of some loopholes. One, nutritionists aren't necessarily certified or licensed by any regulating board. It's a lot of the time certified by different companies. You can often get them on Groupon. And so they may not be the most educationally based or valid. So there are definitely some nutritionists that have like degrees in nutrition or an emphasis in nutrition with their exercise and sports science degree. And that's definitely more trusted. So look at those types of things. But another thing we have to be aware of is the difference between sports nutrition and everybody else. So much of the information that we get, including protein recommendations and so many other things, are based on athlete nutrition. Very few people that you will work with are actually athletes that are working out several hours every day and need a lot of recovery and things like that. Most of us, if we're working out between 30 and 90 minutes, athlete nutrition really isn't as big of a key, depending on how hard you're going and other things like that. But so really be careful with any dietary recommendations, that we're not kind of overstepping bounds, and that we're not giving a layperson elite athlete information. It doesn't necessarily work for them as well as it will the elite athlete. So be careful there. So let's talk about how some of this would work for an actual person. So look at this case example. So one of my favorite cases to talk about is a 30-year-old female, so a mom of 3, and she came in just really frustrated. She's gained a bunch of weight with her first 2 pregnancies and had a hard time losing it, was just really frustrated with things. And so she started that 3rd pregnancy about 45 pounds overweight, and she was just frustrated after those first 2 pregnancies. So she came in, and we were able to do the testing, monitor her throughout her pregnancy. So early on, we were able to do exercise tests. Later on, we just did the resting metabolic tests. That way she was able to exercise for as long as she felt comfortable exercising through her pregnancy, and many can exercise throughout their entire pregnancy. But we were able to do those RMR tests. You're not just eating for 2, right? It's actually not quite that many. And so being able to know exactly how many calories to eat, and so we're not underfeeding her, was really, really important for her healthy pregnancy. This pregnancy, she only gained 22 pounds, and a much healthier pregnancy, so that after delivery, she was able to get back to her normal weight so much quicker. So within 2 weeks, she had actually lost weight through her pregnancy. So she'd lost fat, right? Not really lost weight. That's kind of the wrong emphasis, because she still gained a healthy 22 pounds, but she lost fat through the pregnancy, and then she was able to recover so much quicker and get close to that coveted high school weight. Kind of funny that's one of the things that I often hear as a barometer that people want to get back to, is their high school weight. But so she did so well and was able to manage her pregnancy and have such a healthier pregnancy because of the information we were able to give her through the metabolic testing. So really fun there to be able to help somebody in that way. All right, let's talk about how the exercise testing then can help people achieve the results that they want, both in the performance side as well as the weight loss side. So really, you can do this testing on any piece of equipment that you can imagine. I even had one patient who we did this with an arm bike, an upper body ergometer, and she found a nursing home that would allow her to come in and use their equipment. And she was able to lose 45 pounds, which took so much stress off of her shoulders. She was able to get around so much easier, get her in her wheelchair, in her car so much easier. Oh, it was amazing what that did for her. And she was able to exercise in a way that she was able to sustain it. One of the things that a lot of people do with an upper body ergometer is they get on there and they go too hard and they're gassed and they're not able to spend the time on there that they need to burn not only enough calories, but the right type of calories. And then there's also quite a few blood pressure and heart rate implications with upper body ergometry. So we have to be careful there. And this was able to help her, by doing the testing, know exactly where she should be exercising. So we get a ton of information from this exercise test. So one of the biggest things we get is how you're using calories. And that's one of the main goals, right? Is let's learn how we use calories. So by doing the testing, we can find out exactly what type of calories and how many calories you're burning, fast versus carbohydrates. We can then determine at what heart rate ranges that's going to be most effective to you. So let's see here. So we can learn also what people's VO2 max is, what people's max heart rate is, within reason. So within a test, it's hard to get a true max heart rate, because if they get really fatigued, their heart rate will climb even more, or if they do interval training. So you'll have people say, oh, on my Garmin, I was able to get 5 beats or 7 beats per minute higher than what we get in the test. but it's a pretty good VO2 or a pretty good heart rate max score. We get a VO2 peak, not always a VO2 max. A true VO2 max is where you actually fail, so you go to failure. I don't typically have my people go to failure just because I prefer that they stay upright on the treadmill. I do not, again, want them to be my first big treadmill accident. So if I can help it, I avoid that for sure. So one of the things, though, that we can also get with that, aside from the VO2 peak, I guess what that tells us is their fitness level. So we can compare that to norms and see where somebody stacks up in terms of overall fitness level, so we can make sure that they're healthy and can participate in their fitness. And we'll talk some more about the implications of that. If somebody gets a really low score on their VO2 max score, what that means about their health and their fitness, and what we can do about that in terms of clinical treatment and care. One of the other things that it helps us learn is if there's some cardiac problems, we get a recovery rate at the end of the test, and so we can see how they recover. And that's really important, that people recover and come down from their exercise well, so that they are healthy enough for exercise. All right, looking then, this is kind of one of the big snapshots when we've got it up on our monitor as we're doing a test. This is kind of what the test looks like. Pretty cool to see. All of these graphs give us a lot of different information. Honestly, I probably spend most of my time on the trend table, the trend spreadsheet, just looking at the raw data, because I've done quite a few of these tests at this point. But this is one of the things I look at the very most. Everyone wants to know what their VO2 max or VO2 peak is, but really, to me, it's less about how you do in that peak number, which is important, but to me, it's more about how you use the calories in the middle. So looking at this RER graph again, it's about how you use the calories in that middle portion, where we want people to work out, where they're most effective at burning fat calories so that they can go longer, harder, burn more of what they intend to burn with their workouts. That's where I'm most concerned, and that's what this gives us such a great key in learning exactly how they're using calories for their body. So let's take a closer look at that. This is the printout that we get people. It tells us their heart rate recovery information kind of down near the middle here. Up at the top, it gives us their heart rate in 10 beats per minute increments. And then over on the side, it gives us their calories and calories per hour. We break that down then into their workout zones based on exactly how they perform. We can say this is going to be your primary zone for that building your aerobic fitness. This is your primary zone for building your anaerobic fitness. And these other two zones, kind of that low end zone is your recovery zone. And then that middle yellow zone, that really, I lovingly call those junk miles. This is where most people choose to work out, is kind of in that yellow zone where they can burn calories for about an hour. And so because that's the intensity that they can burn for about an hour, and they choose to work out for about an hour, that's how hard they push it. The problem with that yellow zone is, and we'll look at why, is that's not really a zone of improvement. That's where most people work out and then they kind of plateau. And so the reason why that's not a zone of improvement is we're not really working those peak top end systems where we're stressing our anaerobic systems, but we're also not really focusing on building our aerobic base and being able to go long enough and in that right zone where we're targeting fat burn to train our body to use those fat calories for a longer period of time. And so, especially for endurance training, so many people tend to work out in that yellow zone, and it winds up really being the least effective place they could be. And so we'll talk more. I believe in an 80-20 regimen where we spend 80% of the time in that green zone and 20% in the red zone. So let's look at why. So here's kind of that breakdown as we zoom into the calories burned a little bit more closely. So our initial reaction there is, the more calories I burn, the better, right? The harder I work out, I'm burning way more calories. Let's take a look at why that doesn't always work. When we look at the percent fat burn at each heart rate range, we notice that we're not necessarily all that crazy effective as we get higher up in terms of fat burn and in terms of total fat calories per hour. And so really at those upper ranges, you know, you'd have to burn so much more or for so much longer, you know, at 150 beats per minute for this person. And so this was based on a 47-year-old female. For her, at 150 beats per minute, she's burning 33 fat calories per hour. She'd have to work out for 3 hours to burn as much fat as she would at 120 beats per minute. But the same is true kind of at that lower end. She would have to work out for 2 hours at kind of that 80 beats per minute, 90 beats per minute range. She's not going to burn as much either. So in that range, though, she's much more efficient, right? So we're looking at efficient versus effective. So the old treadmills used to say fat burn zone on them, and they'd have this zone. And most of those are based on fat burn efficiency, not necessarily fat burn effectiveness. I'm more concerned about where we're most effective at burning fat. And so we've kind of rounded these numbers to make them make sense and everything, to make them a little bit easier to digest. But really here, when somebody's in these lower heart rate ranges, they tend to be a lot more efficient at burning fat. As they climb up, they become a little bit more effective. And so we want to look at total fat burn per hour. Where is that person going to be most effective? And so that's how we set that kind of middle zone, or that green zone. So if we can set people up to burn the highest number of fat calories, they're going to be the most successful. One of the other things that we have to look at is the carbohydrate deficit. So essentially, because we only store a limited amount of carbohydrates on our body at any given time, when we burn carb calories, there's a homeostatic drive to replenish those carbohydrate calories. So the bigger that carbohydrate deficit is, the more we're going to have to eat as a response to refuel those carbohydrate stores that we've depleted. The bigger that deficit is, the harder that will be to recover from day in and day out. Consequently, it's also harder for our joints to recover, our tendons and ligaments and other things. So working out at those higher heart rate ranges, yes, you do burn more total calories, but you burn less fat. You need to do a lot more in terms of calories that you have to eat to recover, and in terms of recovery time. And you're just going to burn fewer calories if you work out 3 days a week really intensively than you will if you work out every day and make it part of your lifestyle and your pattern. Then you'll burn more total calories and you'll burn way more fat calories. The other thing is you tend to actually be more active if you work out less intensively. You're more active throughout your day versus a high intensity workout. People tend to be more sedentary for the rest of their day because they're still recovering from their workout. They feel sore and they feel like, well, I already got my workout in, so I don't need to work out, or I don't need to move as much or be as active for the rest of the day. It looks like I've got a question about a VO2 max test. Let's see. Do we need a doctor's order to undergo VO2 max testing? I'm coming from the Philippines. How does this compare to a stress test? Can this qualify as a pre-screen before doing an actual stress test? Actually, this is similar to a stress test. If you had some of the right equipment, you could do a stress test with it, along with it, if you have the leads for doing a cardiac stress test as well, for like the EKG. So yes and no. In terms of the physician's order, you'd have to look at your local laws. Here in my state, I do not need a physician's order, but you might have different state or local or country laws that would govern that. And so you'll have to dive into your individual practice act and see what that is. I know in many states with direct access here in the United States, you do not need a physician referral to do the testing, but each state, it varies from state to state. So the heart rate zones found in typical gyms, that's a great question. So like I mentioned on the treadmills, that's not very accurate. The one problem with heart rate zones is that everybody is so different. We're all a big bag of different chemicals, different life experiences, different fitness levels, so many different things. And so because of that, we're all very different. And our heart rate zones then are very, very, very different. And so that's one of the big keys, is testing to the individual and making sure that we're doing the right thing for their body. And so by having this information versus just the traditional 50 to 60 or 70 to 80 or 80 to 90, 90 to 100 heart rate zones based that way, that are really based on just calculations, and we'll get into that a little bit more, those really aren't very accurate. And we'll talk more about the accuracy of them and why I don't really follow that, and why I think this testing is so critical for getting it right, especially for the individual. And then one other question about ketosis. That's kind of outside the scope of what we're doing today, just because that's a bigger debate and everything. I would say ketosis is really popular. There's pros and cons. It's not healthy for everyone, especially long term. Being ketotic on the long term can be really hard on some of our internal organs and things like that. But a ketotic state can help you burn fat pretty effectively, and people will have really low that respiratory exchange ratio when they are ketotic. But so we might have to go into that in a follow-up visit, just because that's a whole different subject that can get us really off, because it is a hot button issue for a lot of people. So looking at it, we can take a look. Here's kind of an interesting example of training according to this 80-20 principle versus training. This person is more of a CrossFitter. So this is a healthy young 27-year-old male that does a lot of kind of higher intensity workouts. Very good at suffering. So right here is kind of where he started to not burn fat as effectively, and after he really stopped burning any fat at all, he was able still to go for a few minutes before he had to stop the test. He's able to burn a lot of calories per hour, but really not that many. So he's about a 6'1" male, he's quite thin, about 150 pounds, versus a 30-year-old female, I'm trying to remember all her demographics, who's a marathon runner and a multiple-time Boston qualifier, but she's about 5'1", and quite a bit lighter. And so looking at her, she was able to burn quite a few more calories per hour and way more fat per hour. So she had trained her body to burn fat for so much longer. Interesting to see that you essentially recruit more muscles for running. So that was one thing, that he wasn't as accustomed to the running task, and so that's why he wasn't as efficient or effective at burning calories, and he didn't go quite as long on the test and all these other things. But she was able to burn fat for so much longer and so much more fat by training her body with kind of this 80-20 system that I use, so much more than he, because of that adaptation that she had made towards burning fat. And so this isn't the same person, but interesting to see how when training in these precise heart rate ranges for your body where you burn fat most effectively, you can actually train your body to become more effective at burning fat. So you go and you burn fat longer into your activity. All right, so let's talk about how we then use this for kind of follow-up, exercise prescription, and really coaching those patients. So once we've got that information, we're really able to help move them along. So exercise prescription, we base it on their goals. That's the biggest key, is it's got to be about them. We've got to base it on their life and their lifestyle. We can't give everyone the same prescription because everybody has different things they want to get back to. So what are some bad goals that I often hear? One is getting back to my high school weight, or getting back to that, I want to weigh what I told that it says on my driver's license, or that I told the DMV I weigh. That usually isn't a great goal. When it's focused on weight or aesthetics, really not very positive, not very healthy, and people don't really stick to it. A good example is one based on lifestyle modification and their activities, whether that's getting back to grandkids, whether that's playing tennis or golf, or running marathons, or peaking in their performance, being able to run their marathons faster, or their 5K, 10K, whatever, being able to hit their PRs. Those are super, super important. So lifestyle modification, activity-based, and then making sure that your fitness efforts really support your fitness goals. That is so important. Really, that their lifestyle and their fitness are one thing rather than two separate things. So, or that sometimes people try to use their lifestyle as their fitness. One of the most common things I see is like guys that play basketball, and they'll play basketball 3 times a week, and they use that for their fitness. Although not altogether bad, they're the people that wind up getting injured, right? I've got, my wife plays tennis, and some of her tennis friends, same idea. They play tennis 3 or 4 times a week, and that's their fitness, but they don't do anything else to help support them getting better and more fit to play tennis. And so if your fitness is your recreation, you're really at high risk of getting injured. Instead of switching that mentality of thinking, okay, I need to work on my fitness so that I can be everything that I need to be for that activity that I love to do. So really everything we do Monday through Friday should lead up to that race on Saturday, or that long run on Saturday or Sunday or whatever. What we do for our fitness should help support our lifestyle. And so we've got to make sure that we're doing both of those things. And this can really help tune people into what do you need to do for your body and for what you want to do for your lifestyle and for your fitness, so that we can make sure that we are meeting that precisely. So that's where that 80-20 principle comes in, making sure that they're not working out too hard for the majority of their workouts. So they're building up that base, burning the calories they want to burn. They're not too beat up, so that when they go to do their activity that they love to do, they can give it their all. They can give it that full 20% of maxed out effort. So that's one of the things that we really love to do. Sorry, my voice is drying up. Here we go. So some of the key lifestyle patterns that we look at in helping coach people then, and these are really key critical elements I find with everybody that's looking to either lose weight or maximize their potential and their performance. We look at eating pattern, activity pattern, sleep pattern, stress pattern, gratitude, and happiness pattern. Those 5 patterns really are key in helping people to identify where the roadblocks are in their progress and what little steps they can take to eliminate that. So I'm a big fan of little steps. So I like to do follow-ups every 2 weeks where people come in, we redo their measurements, we reweigh, body fat analysis, all those different measurements we talked about at the start. We look at their pattern diaries and make sure that in each of those patterns, their goals that they set were met, and we establish new goals. One of the key is making tiny little goals, 1% goals. I would rather make 10 1% goals than 1 10% change. Making several small goals that I can actually incorporate into this week are going to be easier to accomplish than making one big goal that's going to feel like a hard lifestyle change, and then I'm going to have to kind of restructure many things in my life. I'd rather make a bunch of little goals that it's like just eating 1 more vegetable for lunch every day this week, or 2 days this week, even depending on how bite-sized it might be for them. And then we also offer on the action side of things, strength training and exercise sessions where we do guided exercise sessions to help people be able to learn what they need to be doing for their fitness. So many people don't really know, or they have these roadblocks to their health and fitness, pain, immobility, different things that as a physical therapist, we're really keyed in on being able to help them eliminate those problems. And so that's a big step that we can help take, is help eliminate some of those roadblocks to their health and fitness. All right, so every 6 to 10 weeks, depending on what their goals are, what they're looking to do, then we also retest again. So every 2 weeks, we follow up with them, and then every 6 to 10 weeks, depending on where they're at, we redo all of the testing, RMR, VO2 Max. So that's a common question. Will I have to retest again and again? Yes. Really important that we retest over and over to see how our body's adapted to it, to see how we're doing in terms of our RMR. We don't want to see the resting metabolic rate drop too much. Now, some of that's going to be natural, especially if somebody's losing a lot of weight. They just have less body to take care of, and so their RMR will drop a little bit. But we want to see that maintain or sustain equally in terms of the amount of BMI that they drop. So if we can judge those two things, at the amount of fat that they lose essentially, and the amount of calories that they decrease in their RMR, that those are pretty one-to-one, and that's not too big of a swing. Otherwise, we're slowing down their metabolism and we're just going to lead to frustration and failure. So we take a look at all those things, see how they're doing with the retest, and reset those goals. So another case this one is fun again, because these postpartum cases or these pregnancy cases often are filled with a lot of frustration. Again, this person with their first child had a real tough time losing the weight, started out overweight, was actually able to do really, really well, losing weight very, very quickly because of the fact that she was still breastfeeding. But one of the biggest keys is we were able to help her lose weight and exercise with a moderate program that helped her preserve her ability to breastfeed. So because we were able to do what her body needed and not anything too extreme, she was able to stay healthy through her weight loss journey. Huge, huge key. Common questions: does this work with older and aging adults? Insurance reimbursement, and why not just use some of the calculations that we have? And then why isn't everyone doing this? This is awesome stuff. So we'll talk a little bit more about each of these. Older and aging adults, yes, this is critical for older and aging adults. So our aerobic capacity tends to decline every year. Our strength tends to decline every year. And so really we can fight back against that. There's pretty good information that would suggest that we can fight back against that by helping people to stick to a good fitness regimen. So both cardiovascular and strength training, but we can improve their VO2 max in these older adults by quite a bit with the right type of endurance training. And so the tie between VO2 max and disability is really, really high. In fact, the American Heart Association just released some statements about how a VO2 max test may be the most accurate screening measure that we can do in terms of looking at mortality and looking at functional ability. So really it's very, very helpful at being able to determine how we can help these older adults maintain a healthy lifestyle. So here's one great example. 69-year-old female that came in weighing 212 pounds. She looked in the mirror one day and said, 212 is too much. I just can't do anything. She actually would say that she had to bring everything with her down the stairs in the morning that she needed for the whole day. Sometimes she'd just carry it in her arms, or she'd put it in a basket and drag it down the stairs. Everything she thought she might need for the whole day, because she couldn't go up and down the stairs enough. So she lost 14 pounds in the first 10 weeks, did awesome. She continued to lose weight. Over the next 9 months, she lost more than 60 pounds and really has just done amazingly well. And she, last time I saw her, it's been over a year, kept the weight off, and she just talked about how she's moving up and down the stairs and able to do so much more because of it. That was one of the most fun things when she came in and told me about how she was able to go up and down the stairs one day to get several things. And she stopped at the bottom and went, I just jogged up the stairs and came back down and didn't even realize it. That was a fun, fun moment for me to see people get their life back. That's the key. To really be able to help people, that's the key. So I mentioned that I look more at the data table. So when helping these older adults, looking at this data table, what we want to look for in this is several different things. So we've got heart rate over here, we've got the VO2, and here's where we get that VO2 max score. So here's a person that really wasn't moving very much air. Their VO2 max they got to was probably around 13 or so, really, really low. So how do we help this person that really isn't moving very much air? Their ventilation in liters per minute was really, really low. Looking at kind of the max amount of liters per minute they were able to move, just super low. So how do we help this person? Well, this person actually qualifies as disabled according to the AMA. So because of these classifications, with that rating of under 13, they're actually considered over 60 or 45 to 65% disabled. So that's a permanent impairment. Good news is, because of that, we can justify care, and actually Medicare will pay for this person because of what's called deconditioning. That's the diagnosis code we'll want to use. Medicare will actually pay for this person to have visits to counteract this deconditioning and get healthy again. So we can see upon retesting, people are able to make progress. We retested this person so this is this older lady. When she started, the 69-year-old female, we were able to test her and show, look at this. Instead of 13, this was after that initial 10 weeks, she was up around 16, 17, 15. So I think it came out at 16 was her VO2 max, so she improved by 3 points. But one thing that was really fun was to see her liters per minute jumped up to now in the 50s, almost 60s at one point. So she was able to move almost a third again, not quite, but a quarter to a third again, as much air as she was before. So her lungs just started functioning better. Everything started working better because she was able to move more air. So I hope everyone can see that, kind of where that is in this VE LPM category, but pretty awesome how that works. All right, so insurance versus weight and weight management. So like I said, currently most insurance companies aren't paying for weight management. Some will pay for the testing, but honestly, you really kind of have to prove that they're disabled before they will really pay for much. So often I have people come in and do the testing on a cash pay basis. Some then try to seek reimbursement for that, but we can use that for justifying additional visits afterwards. Cash-based pros and cons, positives and negatives. Really the biggest key there is when people have skin in the game, when they've paid to do the testing, they actually tend to be much more likely to follow through with the program. Every single time that I've had insurance pay for it, that person actually hasn't stuck with the program. And the people that do fork out the money actually tend to stick with it more. When we have some literal cash on the line, we tend to stick to it better. The other negative is that you're never really sure what the program can look like because you're waiting for approvals from insurance and things. That's kind of a big negative. The other thing is people just don't do it. Like I said, I even sold a bunch of gift cards one year for the testing. I sold over, I think, $6,000 worth of gift cards that year. It was between $5,000 and $6,000. I only had $500 worth redeemed because people just, if they're gifted it, if it's given to them, they tend not to stick to it as much as when they have some skin in the game. So that's why I've stuck with more of a cash-based system. Then really, because we can then prescribe, if somebody's low enough, we can prescribe that traditional physical therapy to help them get reconditioned from their deconditioned state. It can help get people in the door, and we can be that bridge from the medical world to that fitness and health industry world where we can help people really get back on track, living their lifestyle and doing all the things that they know and love to do. So one of the big questions then is, this is great, but do we really need to do the testing? Why can't we just use the averages and estimates that are out there? Well, mostly because they're not very accurate. Some of the biggest equations that we have out there that are used most widely for all of our apps, you know, that's in our fitness watches and all those things, they're just based on averages and estimates. And because of that, they're really not very accurate to the individual. So you're talking 200 to 350 calorie variations for the individual. That's huge when talking about your RMR. That's a huge difference in eating. So 100 calories of fat per day of overeating, fat calories per day, could equal about 10.4 pounds per year. And so if we're 200 to 350 calories off, that's just an epic difference that's really going to help frustrate your patients or clients. And that's really why a lot of our calories in, calories out programs don't work too, is that they're just based in bad information that are based on averages and estimates. So on the exercise side of things, the ACSM admits that some of the calculations that are used are, you know, they're on average 7% off for the individual, which can be quite a bit. A 10 beat per minute increment change, as we saw in that previous chart, 10 beats per minute, you can go from 170 calories of fat per hour to 33, and then down to 0, just in a 10 beats per minute increment. And so huge difference. And so if you're in the wrong zone working out really hard, and there's a lot of gyms that based on kind of a 220 minus age and then 60% of that and 90% of that, or things like that, or they use like a Carbonin method or some other things, that's going to really backfire for a large portion of people because they don't fit within that traditional bell curve, or they're even on the edges of that bell curve. If it's not really for you, then you're not going to fit it very well, and you'll be really frustrated in your workouts. And then just some of those other pieces of information about how the calculations just really don't work. And then comorbidity, and like I said earlier, we're our own unique bag of chemicals. We have our own unique biochemistry. And so because of that, everyone's metabolism is different. And so getting that individualized test really, really matters. So here's a great example as to why. It was kind of interesting because both of these women came in at the same time. So back-to-back visits. And they were about the same age. Well, so they were both the same age, same height, and about the same weight. So really interesting to see what they came in at. So their RMR estimate based on their app, based on kind of that calculation, their estimate would be about 1,800 calories. Where they actually came in, the one came in at 2,300 calories per day on that RMR, and the other came in at 1,500 calories per day. So one would be under eating by 300 or by 500 calories. By 500 calories too few. She would be hungry, she would be fatigued. If she exercised, she would be so depleted, she would feel terrible, and she would give up on any effort she was making in a very short period of time because she would feel awful. Even if she lost weight initially, she would plateau hard, she would slow her metabolism down, and then she'd gain the weight back with interest. The other woman, though, she would be eating too many calories by 300 calories. She would also probably be frustrated by the fact that she was gaining weight eating at that 1,800 calorie requirement. So being able to monitor and test the individual is critical. So then if this is true, then why aren't others doing it? Well, historically speaking, everybody's always thought that it was high cost equipment, hard to use. Even the ACSM said it requires expertise and expensive equipment that doesn't lend itself towards being used in the clinic. Well, thanks to KORR, that is no longer true. Technology advancements have come along that have made it so that the equipment isn't prohibitively expensive. The testing is actually able to be done in a time efficient enough manner that you can do it in the clinic. So I do this every day in my practice, and I've actually done fairs and events where I've done the testing. I believe my record was in 2 days with some helpers, we were able to do 42 tests, I believe it was, in 2 days. So because the machine is so accurate with its self-calibration and accurate during the testing, like previous technology wasn't, that we have a true way of measuring, not just in a breath-by-breath system, but a true gathering all of the expired air in a mixing chamber and measuring it in a very, very accurate way. And so because of that, we're able to have that clinical level accuracy that really is important, and we're able to help people. And so bringing that back then, this really is the key to helping people. And I know that prevention is really hard subject to broach, but we do it on a daily basis. We talk about hard things with them, getting them to exercise all the time as physical therapists. And so we have that available time. We are that conservative option. We hit so many of these items here on this list of why we would be perfect for being able to be that preventative resource in physical therapy, and using metabolic testing really is the key to giving us the scientific information and the ammo to being able to do what is really based on true health and fitness rather than fitness fads. And we can help people change their life and lifestyle. With that accurate information, we can help people change. And so that's what I want to help you guys be able to do. And that's why we're doing this free webinar, is just to be able to empower people to know what they can do to have their health, their fitness of their clients and their patients really be impacted and improved in positive ways through the metabolic testing. So that's all I've got. How can I answer your questions, and what can I do to answer your questions? Love to see what you've got for me. I know we've gone through a lot of information. It's kind of like drinking from a fire hose a little bit. But it's so fun to be able to help people out. Let's take a look. So ketosis, we kind of already. Is there an MCID for VO2 max? In terms of change, I don't know if there's an MCID for VO2 max. A lot of people have thought that VO2 max is an unchanging number, that your true VO2 max isn't changeable. And so I think that has probably frustrated some of that research. Truth be told, very few people actually reach their VO2 max, especially people that are unfit. That is a good question. I'm not sure if there is an MCID for VO2 max, but I do know that people can improve their VO2 max, and that as they do, we see health improvements in lots of ways. So I'll have to dive into that more. Thanks for that question. Let's see. Will you be sending out the slides? If you would like us to send out the slides, that's a good question. Yeah, I can send out the slides. I can do that.
So Cameron,
of the slides. Yeah.
Cameron, so this is Julie Kofed.
Yeah.
All attendees will receive a follow-up email, and in that email they will have a link to the presentation. So Perfect. You each will receive access to the slides.
Awesome. Great. So that's great. I'm excited to be able to share that with you. So some of the resources, if you've got further questions, you can definitely reach out to me. I'm on social media, Cameron Garber, and my business is Body Smart. So Body Smart PT Utah is kind of my Facebook and Instagram handle. Feel free to reach out to me. One of the biggest things, though, is I actually have a metabolic testing for clinicians Facebook group, and I'd love to see you all in there. That metabolic testing for clinicians Facebook group really is where I'm sharing more information like this. And then probably the biggest resource is the KORR website. They've been at this for a long time. They've got great information on their website that can help you understand more about the testing. You can see the validation studies where the KORR CardioCoach, that's what I use and own. I own the KORR CardioCoach CO2, where that has been validated against some of the other competitors, which, as an aside, are more expensive. And I feel like this one really suits my needs as a clinician very well. The KORR CardioCoach, what it does for me is it allows me to quickly, effectively, and accurately be able to do these tests and maintain my regular clinic schedule and practice without taking out huge chunks of time to do the calibrations. I can give people actionable information very quickly that helps improve their life and lifestyle. Really, that's why we all got into physical therapy in the first place. You know, kind of that funny, corny phrase is, I got into it to help people. Well, it's true, we did. But oftentimes our practice setting, or some of the confounding factors of insurance and other things, make it hard for us to truly be able to help people. This is one way where we really can, and where people are willing to pony up the money because they're concerned about their health, they're concerned about their fitness. They want to do something that's not a fad, and this gives them that option to be able to do that so that they can really focus on their health, fitness, and be able to succeed and really maximize their goals. And being able to empower people in that way really is fun and important. Any other questions out there? Oh,
it looks like we've about got it wrapped up, Cameron. So I'd like to thank you. KORR is so grateful for the relationship that we have with Dr. Garber, and Cameron, we're so grateful for what you are sharing with our attendees. And I want to thank our attendees for joining us for this webinar. As Cameron said, if you have additional questions, you can go to our website at www.KORR.com, and you can access any of our assets there, or contact one of our technical specialists to ask more questions. So we thank you and hope you have a great Wednesday.
Perfect. Thank you so much. Thanks everybody for joining, and we'll catch you later. Hopefully you follow us, follow KORR, follow me, and we'll be able to keep helping you with any questions you might have. Thanks so much.
techniques.